Medical assistants are really the boots on the ground, the front lines, the worker bees of the outpatient setting.
They're the middleman between the patient and the physicians.
They're the backbone of the clinic. They help a clinic run fully from the front to the back.
To start a typical day, that would be coming in, getting the office prepared and ready.
Set the rooms up and assign the rooms to the physicians.
I talk to patients on the phone, scheduling.
We do an electronic huddle, but then I round, making sure my staff or my MAs are set up for success for the day.
Temperature checks on the refrigerators, chest x-ray imaging, things of that nature that we need to order for the patients.
I may have to download meters, I may have to put away medicines. MAs do a lot of different things in the office.
Come to work every single day, you're around these people every single day. You have your good days and you have your bad days, of course, just like you would in a family.
Every piece, every person is important, from registration to medical assistants to nurses to the physicians. I really don't think one person is more important than the others.
Attendance is crucial because that helps you learn. So if I'm in a situation and I'm there and I learn it, the next time it comes up, I know how to solve it because I was there.
It's important to be here at the time that the clinic starts and even a little bit earlier to make sure that procedures or any prepping is done on time.
We have patients come here for epilepsy, movement disorders, Huntington's disease, Alzheimer's.
Spirometry test, which is the breathing test. We do give injections, so we give biologics.
We also do hemoglobin A1Cs where we get capillary blood from their finger and then put it into an A1C analyzer and run it to get a 3-month average of their blood sugars.
Typically, rooming a patient, you start with, you get their chart. You'll go to the waiting room, call the patient, have them come back.
We take their weight, and then once we take their weight, we go into a room of this setting.
You want to make sure that you have their pharmacy correct, so that if they need any refills or any new prescriptions, that the physician can immediately just send it right where it needs to go.
When you're interacting with a patient, I think it's really important that you face the patient to let them know that you're really fully listening to the patient, that you're not sitting on the computer staring at the screen.
I've had situations where, patients are upset.
There's been multiple times where, patients talk to you in the worst ways.
And you just have to be empathetic. You have to listen and assure them that you're going to do everything that you can.
Try and understand what it is that they're going through, and I try not to take it personal.
Yeah, they just want someone to take care of whatever was not taken care of.
I have a special needs daughter. My family has dealt with hospitals and physicians, and I know from a receiving end what it's like. I approach it from that aspect, and I think of them as if they're my family.
There's patients that I've had that don't speak English, and I feel really honored to be able to help them with that language barrier.
You're the front line, the forerunner of that office, so they see you first, and that's the first impression they get is you. You know you've helped them because they tell you. When it's genuine, they tell you.
IUHP came up with the MA tiering, the MA 1, 2, and 3.
Once I did find out about that program, I was super thankful.
Get your certified medical assistant. Do not just do MA.
My manager at the time was super helpful about allowing that time for me to study.
We're trying to accommodate things for MAs, to have MA bridge programs.
I do want to eventually be a scrub nurse in surgery. Not there yet, but I think there will be.
It's a great place to start in healthcare.
Making an impact in people's lives is rewarding.
I've always liked helping people.
Over time, we get to build those relationships and build those experiences where we start to get to know people by name, get to know their families and things like that, and it's a wonderful experience.